A PA is a healthcare provider that is medically trained and provides high-quality medicine to patients in a cost-effective manner.
PA school is usually 2 to 2.5 years. The first portion is all didactic, where it's really focused on the medical education and the background for patients. And then the second half of PA school is based on the clinical portion, where we really get experience as students in many different specialties and areas of medicine.
I think the difference between PAs and other providers is the medical training. I think that we follow the physician model and have for many years since the program was started in 1968.
But we're also studying things in a broader sense. So where physicians might finish their medical school training and go on to residency where they're specializing in that, so that our model becomes more flexible. We're not choosing one path. We can go from dermatology to emergency medicine, you know, if that's where the need is, or maybe that's where our desired practice changes to.
So physician assistants can really help with patient access. We have a problem, and in the state of Ohio, especially in underserved areas or rural areas, there's a shortage of physicians right now. There's a shortage of med students right now. There's not as many people becoming physicians. Having 17 different PA programs in this state alone, all those PAs that are graduating, that opens so much access to care.
I think PAs have a very important role in healthcare in Ohio. We're really able to reduce the time that it takes for patients to be seen by a specialty.
In our practice, our physicians are booked out 3-4 months, which isn't bad for a specialty, but they can get in with me same day, next day to really help them get better and keep them out of the hospital.
I can share personally, as a PA working in the behavioral medicine space, I'm able to serve a very large population of patients working collaboratively with a physician who is not on site, and in no way am I assisting that physician. I have my own panel of patients. At times it's been 500-600 patients that I've managed.
You know, majority of patients, once you see them and get that relationship established, understand that you're providing them services that a physician would provide as well.
So we've become more of a colleague to our physician members of the healthcare team. We consult when needed. We work alongside each other. I've had physicians who have asked for my input on their own care of a patient.
I chose to be a PA so I could help patients understand complex diseases, help them feel comfortable with their treatments, and feel empowered to ask questions to their healthcare provider without feeling nervous or scared about it.
I think that we're a bridge between the community and the patient and what was the healthcare model of the physician model. So I think that we offer opportunities for patients to be seen, maybe have someone that could spend a little more time.
I think patients are very verbal with their expression of appreciation of the PA profession. If you've ever worked with a PA, they'll tell you first and foremost, they hear it straight from the patients. I love my PA, I love working with my PA.
I like being a PA to really see the difference I can make in lots of patients' lives. I have the opportunity to really sit down and spend the time with them. I'm not as busy as my physician colleagues, so I can really take the time to listen to them, and they really appreciate that.
The AAPA recently commissioned the Harris Poll, and in that what we found were that they're very aware of physician shortages. They're very aware of provider burnout. The cost of healthcare is astronomical for some patients and quite frankly unaffordable. Those patients who were polled, up to 66% of them reported waiting a month or longer for access to care, which is incredible when you're suffering. And interestingly, when asked, 9 out of 10 supported the PA profession and supported the reduction of legislative barriers to allow PAs to continue to work and expand access to care. So I think the patients speak.